Union Test Prep's ServSafe Manager practice test. There will be a brief pause after answer choices are given. This is a great time to pause the video to solve. Question 1. A customer has been diagnosed with a foodborne illness and calls to inform you. As manager, what should be your first step? A. Gathering information. B. Reporting to the local regulatory authority. C. Reevaluating food safety programs. Or D. Discarding the responsible food. The correct answer is A. When foodborne illness has been linked to your establishment, your first step should be gathering information, including what the customer ate, their symptoms, and their contact information. Then isolate, label, and set aside, but do not discard, the responsible food. Contact the local regulatory authority and reevaluate any food safety programs. Question 2. Which of the following would be considered a TCS food? A. Avocado oil. B. Raw whole potatoes. C. Frozen shrimp. Or D. Sliced melon. The correct answer is D. TCS foods are foods that need time and temperature control for safety because pathogens grow best in them, and sliced melon is considered a TCS food. Sliced produce, raw proteins, eggs, baked potatoes, cooked starches, bean sprouts, and untreated garlic and oil mixtures are all TCS foods. Question 3. The A in Fat Tom stands for A. Arid, B. Acid, C. Acrid, or D. Any. The correct answer is B. The acronym Fat Tom is used to remember the conditions that promote bacterial growth. The A stands for acid. Fat Tom stands for food, acid, time, temperature, oxygen, moisture. Bacteria need varying degrees of each in order to survive and, in some cases, thrive. Question 4. Seafood must be cooked to an internal temperature of blank degrees Fahrenheit. A. 135, B. 145, C. 155, or D. 165. The correct answer is B. Minimum internal cooking temperatures reduce pathogens to safe levels, so certain foods have specific cooking requirements. Seafood should be cooked to an internal temperature of 145 degrees Fahrenheit to safely reduce pathogens. Question 5. Staff should be blank work if they experience jaundice. A. Restricted at, B. Monitored at, C. Received at, or D. Excluded from. The correct answer is D. Any employee experiencing vomiting, diarrhea, sore throat with fever, or jaundice, or having an infected weeping wound or boil must inform management before coming to work. Management should then inform that employee that they are not to come to work. Therefore, staff experiencing jaundice should be excluded from work. Question 6. The blank method of stock rotation ensures items with the earliest use-by dates are used first. A. HACCP, B. NSF, C. FIFO, or D. TDZ. The correct answer is C. The first in, first out, or FIFO method, ensures items with the earliest use-by or expiration dates are used before items with later dates. Items with the earliest date should be stored in front of items with later dates, and anything past its use-by or expiration date should be discarded. Question 7. Blank containers pull heat away from foods faster and should be used when cooling hot foods. A. Stainless steel, B. Plastic, C. Ceramic, or D. Copper. The correct answer is A. Multiple factors affect how quickly hot foods cool, and cooling food introduces time and temperature issues when done incorrectly. Stainless steel containers help pull heat away from food faster than plastic, so they are best. Food thickness, container size, and surface area also affect cooling time. Question 8. Check food temperatures on a hot foods buffet every blank hours. A. 2, B. 3, C. 4, or D. 6. The correct answer is A. Foods being held on a hot buffet are at a risk of time and temperature abuse if they are not kept out of the temperature danger zone, so check temperatures every 2 hours using the proper thermometer. This allows time for corrective action if needed, such as reheating a food that isn't hot enough. Question 9. Which of the following is not one of the 5 common risk factors that contribute to foodborne illness? A. Using contaminated equipment. B. Writing all recipes in standard format. C. Purchasing from unsafe sources. Or D. Having poor personal hygiene. The correct answer is B. Active managerial control, or AMC, is a proactive practice to identify and actively control risk factors along the flow of food. Writing all recipes in standard format is not one of the 5 common risk factors known to contribute to foodborne illness, but the other 3 choices are. It's a manager's responsibility to control these risks. Question 10. Water used for sanitizing must be at least blank degrees Fahrenheit to effectively sanitize. A. 131, B. 151, C. 171, or D. 181. The correct answer is C. Hot water used for sanitizing must be at least 171 degrees Fahrenheit to be effective, and items must be soaked in the water for at least 30 seconds. Another way to heat sanitize would be to pass items through a high-temperature dish machine. For free practice tests, study guides, and flashcards for the ServSafe exam and other standardized tests, please visit us at uniontestprep.com.